Okay, so we only want the doctors to be with us. I have two definitions. One is called helical pitch and the other is called pitch factor. All right? The helical pitch is more commonly used in single slice or single detector systems, while the pitch factor is for multi-detector systems. So what is helical pitch? Helical pitch refers to the distance that the table moves during imaging. The helical pitch is about the distance. The distance left by the table during rotation time is related to the size, which can be either the slice width or the beam width. The slice width is the same as the beam width. Because when you are working with a single row of detectors, I have an X-ray beam and a patient, meaning I have one row or one detector for the X-ray. I have one detector. So I make the calibration and adjust it approximately to the slice thickness I want. For me, the slice width is the same as the beam width, so there is no problem. I see the table moving a certain distance. It can move 8 millimeters or 1 millimeter, and the slice width is 1 millimeter. The helical pitch or the pitch factor is 1 millimeter, which in my case equals, okay, let's speed it up a bit. The table moves a distance of 15 millimeters. So what is my pitch? It would be 15. You will always find the values of helical pitch, which are 8, 5, 10, and 15, as they always represent the speed of the table's movement relative to your slice thickness. If I want a small slice thickness, the speed or distance the table moves will be large. And this, of course, comes at the expense of resolution, because at that time, for example, if I am taking a set of, in CT, computed tomography, look, when I take a slice and move, then take another slice and move again, this movement, if I increase my pitch, allows the movement during the scanning process to be faster. This reduces my resolution. This is the meaning of helical pitch, which is no longer applicable to the machines or devices that are available. Helical pitch is a concept that applies specifically when you have a single row of detectors in a CT scanner and you are utilizing the helical pitch technique. This method is particularly significant in the field of medical imaging. In the past, there was an option to use helical pitch, which was a common practice, but you were working with single slice imaging, which was the standard at that time. Over the years, advancements in technology have led to the development of multi-slice imaging, which has largely replaced single slice imaging. However, understanding the historical context of helical pitch and its application in single slice imaging is crucial for comprehending the evolution of imaging techniques. For instance, in earlier medical imaging scenarios, helical pitch allowed for more efficient scanning processes, which was a breakthrough in achieving better image quality and faster scan time. What are you doing? You are taking a slice, yes, and then you move again. So the table is actually stationary. But what is the idea here, that perhaps you are working alone in this particular situation. Here you have a missing part. What is the missing part? Is there something that happened between the series or not? Was there something that happened between the series or not? This was in the context where you couldn't do anything about it. So, what are you working on? Why are you working on it? Because at that time, you are talking about the table that is moving. The distance the table moves during the rotation time is related to the beam collimation. Why beam collimation? Because here we don't have just one row. I'm talking about multi-slice. Here I have several detectors and I have multiple rows and columns. All these rows of the detector cannot be referred to as slice width or detector width or beam width, right? Why? Because the beam width does not actually determine the slice thickness. The beam I have is fixed width for me, while the patient here has a collimator. I control the size of the beam after the patient according to my desired thickness. So, what is the significant factor for me regarding the detector in multi-slice CT? I say the distance. The table moves is 16 millimeters, for example, per rotation. The beam collimation means how many rows of detector I have which is 16, and each row has a width of 1 millimeter. So 16 times 1 equals 16, which means the beach factor is 1. This refers to the covered volume, and the beam collimation expresses how much covered volume I have. These two are the story. It tells you that there is something called pitch D and pitch X. The first one refers to helical pitch, and the second one refers to pitch factor. This is correct, right? Here it is. I am just opening it now. Can you see? Move, Shaif. What do you think about that? The slice pitch, which I mentioned earlier, refers to the same concept as the pitch factor. It's a straightforward idea. It's just that simple. To elaborate further, the slice pitch is a crucial aspect in understanding the overall pitch dynamics, and it plays a significant role in various applications. By comprehending the slice pitch, one can gain deeper insights into the pitch factor and its implications. We will now address the artifact. Okay? We are just repeating the same information. Today, God willing, we will continue the section on artifacts, and we will discuss CT dosimetry and the calculations of patient dose in CT. In this session, I will elaborate on 3 types of artifacts: those based on physics, those related to the scanner itself, and those that arise due to external factors, which can have problems. One of the most common issues is when there is metal present, which can cause artifacts. For example, if you are injecting contrast in this manner, or here, for instance, in dental imaging, it can lead to various artifacts. Metal, such as dental fillings or surgical implants, can interfere with the imaging process, causing streaks or shadows that obscure the image. Additionally, CT dosimetry involves understanding the distribution of radiation dose within the patient, which is crucial for ensuring patient safety and optimizing image quality. Calculating the patient dose in CT requires careful consideration of factors such as scan parameters, patient size, and the specific area being imaged. By understanding these elements, we can minimize unnecessary exposure and improve diagnostic accuracy. I will take the approach of starting with something at the beginning. Or even the contrast agent shows 2 things. Or you have the 2 forms that appeared. There is a white flower and a black flower, right? Everyone takes a calamity from them. Okay, so there are white lines and black lines. Can we say why these artifacts appear white and why I have both types? For example, why didn't only the black appear and why didn't only the white appear? The same thing applies here. There is a dye here, and also there is a black artifact, and you will also find another white artifact. Why do I have both types of artifacts? Black results from a phenomenon known as beam hardening, which occurs when lower energy photons are absorbed more than higher energy photons, leading to a darker appearance in the image. On the other hand, white results from a condition called photon starvation, which happens when there is insufficient photon energy reaching the detector, resulting in a brighter appearance. This means that these are types of artifacts that are similarly present in imaging processes, affecting the quality and accuracy of the result of the. What does beam hardening mean and what does photon starvation mean? Now, if we remember together that we were talking about the half value layer, we said that when I have an X-ray with a spectrum of energies and it hits it starts to remove what is present and begins to pass through the spectrum. I was talking about, for example, if this spectrum is from 100 kiloelectron volts, and if I remove the range from 10 to 30, I will have from 40 to 100. So when you say the average energy from 40 to 100 is higher than the average energy from 10 to 100, this is what happens in the X-ray spectrum. The line or digital line represents from 40 and above. From the L, and this is what happens in the L. What does this represent? The spectrum that is incident on the material, which is still at the beginning, has not yet occurred between it and my material, which is less than the new one. Okay? So it is less than the minimum average energy. All right. As I mentioned, when you take an average from 10 to 150, but when you take the average energy from 40 to 100, you will find something like 60 or 70. In this case, you have increased the energy. Since you have increased the energy, this is your average energy, and your average energy has increased with the new spectrum, while you have removed part of the quantity or number of X-rays. I call this the beam hardening effect. The beam hardening effect is that you are increasing the average energy. So, if you have increased the average energy, you have increased the penetration power. When does this happen? It occurs when I have the incident X-ray falling on a high-density material, like a dye that has high density. Not just any high-density dye, but a more concentrated dye, like one that is still injected and has not yet been diluted with the solvent. So, at that time, the concentration is very high, and beam hardening begins to occur. We said you have increased the penetration power. So when you come to increase the penetration power, the energy of the X-ray photons that pass through the high-density part, whether it was a metal or a dye, has high energy. So what will it encounter after the dye or metal? It will encounter soft tissue. And when it encounters soft tissue, it will pass through it. A larger than normal amount means attenuation. Will it be able to stop the high energy X-ray photons? Or will the attenuation it causes be low or high compared to the X-ray photons that have passed through? This means that the transmitted signal that will certainly reach the detector will definitely indicate to me that the intensity or energy that has reached you reflects what? It reflects that this place has undergone attenuation. Now, a place that undergoes attenuation, like what? Like air. So, I would express it as a black color. This means that when the signal is placed on the image, it will be in black or white, or the soft tissue will appear darker than normal, because this area did not undergo the natural attenuation that was supposed to happen compared to the surrounding tissues. Why? Because the X-ray photon that passed through the metal part has high energy, and thus the soft tissue attenuation is only 1. But in the area where the high energy fell, it won't be able to attenuate in the way it was supposed to. Therefore, what reaches the detector will give me a strong signal. This strong signal in the detector will be interpreted as if it is coming from an attenuating material like air, and it will be translated to black. This is the reason for the appearance of the black stripes that are present. Is that clear? Good. This is also understandable. All right. So what now? Sorry, the observation and the victim are more accessible, huh? He doesn't work on his own. He works on the primary energy. He essentially considers that This primary energy means that most of the photons carry this energy. So what I mean is, I didn't say that, for example, I entered a classroom where the average height, or most people, are 160 centimeters. So I consider that in this class, the height of the people is 160. It will be considered that the spectrum here for me is like a monochromatic or monoenergetic X-ray, so it will deal with the main energy for me. This is the value I will work with because most of the photons carry this energy. The number of photons that carry high energy is low, and those that carry low energy are also few. But this part is the effective part for me in the spectrum. This is the part in the middle, the part that carries the main energy for me. Okay, doctor. Let me clarify more. Okay, so we are talking about energy, but there is also the point about the number of photons that have passed. We removed the soft tissues. So what has been reduced in the number of photons that passed since we removed the soft part? It turns out that the main energy has increased, but the intensity of the radiation has decreased, meaning the number has gone down. As the number decreases, the number that will reach the detector also decreases. Be aware of the difference between energy and number energy and intensity. The number of photons that will pass through the metal part will be few. So when you interact with the soft tissues present, the number is insufficient. This means that there are parts that will not receive enough interaction. What does this mean? It means that something called photon interference will occur, where the photons that reach the detector, despite coming with a high signal, will have parts of your image or shape affected. In some parts, they will appear white. Why will they appear white? Because the signal or connection in this part will be low. As a result, this number will be low. At this point, it will be considered that we have already discussed the first part and understood why this happens. Now, why is there a white part? It should be the opposite. How is that? This means that this part will start to represent as if something happened. The idea is that this part experienced a reduction in the number of photons, leading to a decrease in the signal, specifically the number of photons that reach the detector in this part. This reduction is not understood. It will be expressed as significant attenuation in this part, which will start to show a white color, similar to what happens with bone or with the previous part. That's why you see the white and black stripes present. So there is a reduction in the number of photons, and this is the part that will interact with the small number of photons. Therefore, we will represent this part in white because the signal that will reach it will have a low number of photons. It will be considered that attenuation has occurred, and this attenuation will be represented in white because there has been higher attenuation due to the low number of photons that reached it. Meanwhile, the energetic part that passed through is the high energy part that will interact, and this is what will give a higher signal. That's why you will always find that the white part corresponds to the area that is present for the brown part. In summary, the part that has high contrast will show the stripes more prominently in the soft tissue areas or the fat surrounding the part that is causing the artifact, whether it is the metallic part or the cause itself. As for the patient motion, it is well known that the patient cannot control their breathing. The blushing does not control if, for example, you are working on something unrelated to the neck in the swallowing process. Also, there are factors that can cause artifacts during cardiac imaging, such as breathing or even the instability of your ECG. Arrhythmic cases or an unstable ECG can lead to the presence of beats, which can cause a double contour effect, whether it appears here or elsewhere. This is, of course, a result of various factors, and this is an example of what is present, this is like the artifact present. Of course, there are things that are used to treat metal artifacts, which are called metal artifact reduction software, and there is also Siemens. These things are available today, and you can present the artifacts as you see. This is an image after the presentation where the artifacts completely disappear. As we see, this is the presentation available, and the artifacts disappear entirely. Of course, this software is available on devices whether they are Philips, Siemens, GE, Newsoft, or Tever. Now, the meter artifact software is a type of iterative reconstruction algorithm. Its main idea is that it looks at a part where there is an artifact, for example, in this area, and examines that part. It checks what the value should be next to the artifact point here and processes it accordingly. For example, in this area, there is an artifact. So it will look at the pixel that does not have an artifact and see what its value is. Its value is like this, and then the line that has the artifact will return the pixel value to a value similar to that of the neighboring pixel. It will start doing this for the entire image, correcting the image in this way. This is a type of, and this is the beam hardening. There are some cases that are not exactly useful, like lower limb angiography in certain situations, especially when performing a case like a geography with the lower limb arteries. It can be a bit difficult if there are stents or similar issues present. It appears as if there are some blockages in the arteries of the lower limb, and honestly, this doesn't show up even if you use the appropriate techniques, of course, for the patient. In terms of movement, you can accelerate processes significantly if, for example, perhaps more specifically, for instance, a patient is afraid to move with you. You can reduce this fear by either increasing or decreasing the amount of movement involved in your procedure, which shortens the rotation time and thus reduces overall examination time required. Ideally speaking, if you work more efficiently than before, spiral scanning is much better suited for your needs. There is also in the field of medical imaging, particularly in the area of cardiac imaging, there are several specific aspects and considerations where one starts to choose and focus on particular areas that exhibit less intensity. The primary aim and objective is to create and establish certain distinct phases in the heart in order to observe those regions with lower intensity or less activity, ultimately resulting in clearer and more precise images. This technique and approach is particularly available and utilized in the process of angiography, and it is routinely performed by specialists in the field. It is very easy, straightforward, and uncomplicated to work with patients, of course, if the patient rights themselves and remains comfortably asleep without any issues. And of course, the patient is thoroughly informed and well briefed of all the instructions that will help them understand the examination, the message, and the message of the self before we conduct the educational examination regarding the artifacts related to the patient. Now let's talk about some well-known artifacts that appear in physics. We are discussing in physics beam hardening and photon starvation. Certainly, undoubtedly, In fact, as a matter of fact, these are important concepts to understand. We talk about something called the capping effect of beam hardening, which we have discussed or explained before. The same thing happens even if there is no metal or no dye, like this area, which is very famous for being in the brain in this way, the postelocal fossa. This is due to it being surrounded by the dense bone, which acts as if you have placed metal or dense material, and it shows the blackening present on the images. Of course, we have previously explained the concept of beam hardening and what happens in it. As I mentioned, there are some beam hardening algorithms available that can update this artifact, as we see, and they can remove the artifact present from this. All of this is simply done using the iterative beam hardening algorithm or the iterative beam hardening update. There is something called the capping artifact if we neglect the topic of the X-ray tube.